My name is Dr. Emmy Oji. I'm one of the podiatric surgeons at Valley Foot and Ankle Specialty Providers. I've been practicing for 10 years. I got my undergrad degree from University of California, Davis. Go Aggies. What inspired me to be a podiatrist? Well, actually, after my undergrad degree at Davis, I actually met a couple of podiatrists, and they served as my mentors. I got to really know who they were. They brought me into the field of podiatry, and I started to, follow them and shadow them, and I thought it was a pretty cool field. Podiatry is a microcosm of the entire medical field, so you're mainly dealing with the entire lower extremity. But I think if you ask my colleagues and my patients, they'll say I focus more on sports medicine, a lot of diabetic limb salvage, whether it's some amputations or debridements of wounds or Charcot reconstructions. That's what I typically do, and I enjoy doing that. If you ask some of my colleagues, they'd say I live and breathe podiatry, but that's not necessarily the truth. I do enjoy exercising. It's a form of relaxation and stress reliever. But I also enjoy reading. What does an average day for me look like? Busy, very busy. I'm usually up before 5 and either going into the hospital or rounding and seeing the patients. And then I'm in the office for clinic around 8 a.m. And then sometimes I have cases or surgical cases to follow. So it could be a long day, but I love it. It's challenging and it's rewarding. It's great to interact with patients, actually. I love interacting with patients. I like coming to the office. Each patient has a different story. When you talk to them and you get to know them, you can see like, wow, there's just so much to them. So for me, it's actually interacting, and it makes the day go by fast. And just getting to know the patients, it's great. I wish the patients knew that your story actually matters, that I'm looking at them from a global perspective. If they're coming to the practice or the office to talk about your foot, a lot of your ailments actually stems from something systemic or deeper. So they should be aware that we look at them from a global perspective, and what they tell us really, really does matter.